Hello, everybody. My name is Ali, and today I'll be presenting on exploring deep brain stimulation as a treatment procedure to reduce motor symptoms in an individual living with Parkinson's disease. So I'll share my screen with you guys, and then you can follow along. Perfect. Okay. So to start off, you're probably wondering, what is deep brain stimulation? So deep brain stimulation is basically surgical therapy used to treat motor symptoms of Parkinson's disease, targets the area of the brain that controls movement. And here's a little video I'll have playing while you guys are listening. So basically, how does it work? It's a DBS apparatus composed of electrodes that is implanted near the brain structures, and the pulse delivers electrical stimulation targeted to targeted brain areas to change the electrical activity of the patterns. The picture below the video just demonstrates stimulation that can be modified by altering the pulse width, frequency, amplitude to meet with specific needs of the individual. Perfect. Go to our next slide here. Okay, so deep brain stimulation surgery. So pre-surgery, we're looking at the diagnostic imaging of the brain to identify the location of the targeted area. Implantation of a thin wire led to a targeted brain area, and then electrodes on the wire contact that brain area, which is connected to a wire that connects the pulse generator. And then the pulse generator is inserted in a subsequent surgery. So the video was just playing there. I'll play it one more time, but this is basically somebody who has deep brain stimulation, the before and after, which is kind of cool. And it is controlled. The individual can control it using the controller that allows them to turn the device on and off. And the electrical impulses are sent to the target brain region from the pulse generator that receives input from an external remote. Okay, so best candidates, you're probably wondering, can it be anybody who can have it? So it's most effective for people experiencing disabling tremors and basically not having a great quality of life. So other criteria includes Parkinson's disease lasting for at least 4 years, and then interfering with daily activities, because it's no fun to can't function in everyday life. So the pros: there's minimal permanent surgical changes to the brain. It's invasive, it's reversible, and it's individualized to each patient. And then the cons, just like every other surgery, infection, bleeding, and swelling. Possible complications can be headaches and seizures, and then wear and tear of the hardware, requiring more surgery to replace the parts. So now that we kind of told you a little bit about what deep brain stimulation is, we're going to go into a recent study describing the efficacy and the population of the results. So if we take a look at this study, so Parkinson's disease, neurodegenerative disorder with symptoms like tremors, rigidity, and postural instability. So we take a look, this chart kind of demonstrates the differences in the medication versus neurostimulation. The methods, randomized pairs experiment involved 56 patients with severe motor symptoms and advanced Parkinson's disease using the 2 different questionnaires. One's a PDQ-39 and one's another similar questionnaire that talks about mobility. The efficacy was that neurostimulation significantly improved the scores in patients without medication, with reduced immobility, increased mobility, and increased sleep time with reduced mobility, which is quite interesting. So we then go into the interventions. So the surgery, implanting the electrode and the pulse generators for continuous electrical stimulation. Medical treatment received personalized drug therapy, and then both of these were implemented for 6 months. The results were kind of cool. So it was a improved PDQ-39 and UPDRS-3 scores compared to medicine alone. And so this bar chart shows the comparison between neurostimulation and medication, and only changes in neurostimulation to show improvement, as well as quality of life. So some examples include bodily discomfort, social support, and cognition. So in conclusion, the study found neurostimulation improved the quality of life, which is super cool. So overall, DBS shows an improvement with most patients related to motor symptoms and the quality of life for those with Parkinson's disease, which is super cool. Thank you for listening.